Good afternoon, and thank you for joining us. As we have in the last few weeks, we are again reporting that the County of San Diego remains in the red tier on the state's blueprint for a safer economy. Our success in maintaining that delicate hold is due to the high testing rate for which we've averaged a very good number that the state has been pleased with, and the low health equity testing positivity percentage, which we're going to hear more about in just a few minutes. But again, staying in the red is not our goal. Our goal is to improve our local situation to the point where we can go to less restrictive tiers and allow more businesses and activities to resume. We know that's going to be hard, but we can do it. It's up to each and every one of us to make that happen. And we can do that by practicing all the safety measures we've been talking about every time we come together. Wearing facial coverings, social distancing, avoiding large crowds, and hand washing regularly. Our fight against this pandemic has gone on for a long time, but we've got to keep it up, and we still have a long way to go. This week, across the nation, we've seen a resurgence of coronavirus in many states to the point that some were running out of hospital beds. We don't want that to happen here in San Diego. So let's keep up our good work and get through this difficult fall and winter season. In addition to receiving this information and an update at our Board of Supervisors meeting yesterday, the board also took further action to help local businesses struggling with the loss of revenue due to the pandemic. At the meeting, the Board of Supervisors voted to extend the deferral deadline of annual health permit fees, plan check fees, and late fees for restaurants and food facilities. The action also includes an extension of permit and inspection fee waivers and deferrals, lease payment deferrals, ordinance amendments, new programs, extended services, and continued business assistance programs as previously directed by the board. The deferral and waiver period for these fees had expired or will expire very soon, but they have now been extended through March 31st of 2021. These actions will help many businesses get through this difficult period. In addition, yesterday the Board of Supervisors approved more economic stimulus grants to help small businesses recovering from the pandemic. To date, the board has approved about $28 million for all small businesses and our small business stimulus grants to businesses throughout San Diego County. This has resulted in over 3,100 grants being awarded throughout the county. In South County, in my district, I've provided grants to 603 businesses totaling $5.5 million. We will continue to do what we can to help our businesses. With that, we'll move on to our updates with Supervisor Nathan Fletcher and Dr. Wilma Wooten. Today, we also are joined by a very special guest, Chula Vista Council Member Steve Padilla, who is a survivor of COVID-19, and he'll give us his unique perspective having fought this virus. With that, Supervisor Fletcher.
Thank you, and good afternoon. As you're going to see from the numbers in a little bit, we are holding steady in San Diego County. That is much better than many places around the country and the world, which are seeing significant spikes and increases. And we thank the overwhelming majority of San Diegans who are doing everything right. They're making a tremendous daily effort to follow the public health guidance, utilize the mask, avoiding indoor settings, physical distancing with non-household members, washing their hands. We thank the small businesses that are adapting their operations to be safe, the families that are avoiding gatherings, the schools that are fighting to try and get kids back in a learning environment in a safe way. But the reality is not only can we not let our guard down, we have to all redouble our efforts because we are holding steady right at the precipice of the tier of potentially going into a more restrictive category. We also know that we are heading into the holiday season. We're having more schools come back online. And all of these are things that if we are not exceedingly cautious and careful, have the potential to increase the case count. And we have zero margin for error with where we are. We would like to see our numbers descend. We have seen other large urban counties descend into less restrictive tiers, so we know that it is possible and it is doable. We just have to continue to find that vigilance. And, you know, we're all aware, we go back to March when we started this, the journey that we've been through, the difficult challenges that we've faced as a community, but also facing the reality that it's not over. We have to continue to be mindful. Coronavirus is just as contagious today as it was in March, and so we have to continue to fight every single day, both to save lives, to protect our healthcare workers and healthcare system, and also to protect our economic recovery. And that takes each and every one of us reminding each other daily of what is at stake and what we all have to do. We also, I think, in some ways should recognize as a region we are doing well in holding steady. We obviously want those numbers to go down, but as we head into the fall and winter season, colder weather, temperatures, the spread, it is important to keep in mind that this has the potential to take off, and we want to make sure we continue to fight against that. I was reading about Grundy County in Chattanooga, Tennessee, a very rural area that had seen very low impacts from COVID, but in this small rural county, their case count is now over 60 cases per 100,000 residents. They've seen exponential growth that is threatening what they're doing. Washoe County in Nevada today called an emergency meeting of their health district because their active cases are over 2,000 for the first time. They've seen a 50% increase in cases just in the past 2 weeks. The state of Illinois has seen their positivity rate continue to rise and climb. They've now seen more than 6,000 new COVID cases and 51 deaths just on Wednesday. The 7th time in 8 days, their case rate has been more than 4,000 cases, and this is impacting the entire world. In Germany today, they announced a month-long shutdown of bars, restaurants, leisure activities, and other things as they've seen spikes. Here in California, we're not seeing those same level of spikes because of the tiered system, because of what's been put in place, because of guidance around gatherings and face coverings. We are holding steady while most of the rest of the country has seen significant increases. But those systems are put in place to try and ensure that things don't get out of control. By the time you have exponential growth and spread, it is too late to stop it. And so we have to continue to fight, continue to work to get into a lower tier and continue to support each other through this process. I just want to announce before we jump into our numbers, a milestone that we hit. If you remember back in March, there was a lot of effort, or a lot of focus, I should say, around efforts around homelessness with the convention center, efforts we did in shelter, but in particular our hygiene kits. These are for unsheltered individuals, hand sanitizer, wet wipes, water, masks, information on COVID, information on flu shots and other types of things. And I'm pleased to report that we just surpassed a milestone. More than 15,000 hygiene kits have been assembled and distributed. And so I want to thank our Health and Human Services Central and South Regions homeless team, our county public health nurses, and the 63 homeless service providers, nonprofits, charity, and faith-based organizations that have all been a part of distributing those kits to those most in need. Before we hear from Councilmember Padilla, let's run through our weekly numbers. What you'll see right there at the top, our 7-day average of testing is 11,268. Our testing has been what has kept us in the red tier. The ability to increase that testing, to gain that adjustment factor, to be well above the statewide average is what's allowed us to keep our current business posture around openings. And so we're grateful for all of the folks that are part of our testing team, our county public health lab, our folks there, all of our healthcare system partners, the clinics, and everyone who have done a good job. Our 14-day average percentage of new cases, there you see 2.7, 1.4 million tests. In the middle there, you see case investigations and contact tracing again continue to perform well. Quick turnaround time and making that initial contact within 24 hours. Next slide we'll go to is our testing turnaround time. And again, as we have significantly increased the number of testing we're doing, we've been able to maintain the integrity of the turnaround times. And this is vitally important. Case investigations and contact tracing do not work effectively if you don't have fast turnaround of these tests. And so you really see an incredible speed at turning those around across all of those reporting entities that are a part of our testing community. Next on our charts for cases today, we're going to report 330 new positive cases out of today's more than 11,000 tests total. Again, that's a 3% percentage of positive for today. You see our rolling 14-day average of testing percentage of positive there holding relatively stable, just under 3% presently. You can see a drop a while back, and again, that day-to-day totals are not as important as the general trends, and we would like this trend to start tilting downward a little bit, but we are holding steady, and that is good. Next, on hospital census, you see ICU utilization there at 90, 247 total. Again, hospitalization numbers are very good and encouraging for where we are. The 247 COVID, on the next chart, you'll see it in the total of all hospital system patients. Again, 4,163. Plenty of room below that 80% reserved for COVID at 4,810. And the final one is our ICU utilization. Again, right there at 66%. Again, has been holding remarkably steady and flat going back beyond the previous month. That is our update on our numbers. Next, I want to introduce a special guest we have here today. When we talk about COVID, the majority of what we tend to talk about is the case rate, the tier, the percentage of positives, the hospital system capacity, or various guidance that is coming out, or things that we're working through. But I think it is important that we all take pause and remind ourselves that this disease is very serious. Even if it has a high survivability rate, particularly for those that are younger without underlying health conditions, it is still not something that you want to catch. We're reminded of the hundreds and hundreds of San Diegans who have lost their life this year from COVID, and we're reminded that even those who survive often have very serious and significant experiences in fighting this virus and battling against it. And so to help share with us a little bit of his experience is a dear friend of mine, a valued member of our community, a member of the Chula Vista City Council, the chair of the Coastal Commission, but also someone who firsthand went through and dealt with his own COVID experience, and we are very grateful as a county that Councilmember Steve Padilla is here today to share with the public what it was like and what he went through and his advice and guidance for all of us. Steve?
Good afternoon. Afternoon, and Mr. This is better.
The other mic's working.
Sorry. This is good? Okay. Afternoon, and thank you, Supervisor Fletcher, for your invitation. Thank you, Mr. Chairman. Thanks to all of you for inviting me here today. First, I'd like to think we should recognize the fact that as of today, nearly 1,000 medical professionals, frontline, throughout our nation have lost their lives in service as a result of this pandemic. Over 1,000 today, and some of whom cared for me very well during my time. I'm one of the lucky ones. This past March, as a result of my public duties for the state of California, I was exposed to COVID-19. And within a matter of about a week from the onset of my symptoms, I was in an intensive care unit, intubated on a mechanical ventilator, in an induced coma. The virus nearly took my life. I was the first official in the state to have the dubious distinction of coming down with COVID-19. I can tell you that that experience is deeply emotional and personal, and is very real. During that time of my hospitalization, nearly every natural function, every life-sustaining function was done for me artificially. I had single organ failure. One of my lungs collapsed. I nearly had multiple organ failure, which would have likely resulted in my death. I was lucky to have some of the finest health care coverage and access to care in the country. I was blessed to have access to some of the finest care medical professionals at UCSD Health that saved my life. But there was no magic bullet. There was no therapeutic. There was no cure. There's no vaccine. I didn't have access to experimental drugs. I had good supportive care because in my case, my body was spending every ounce of energy it had to simply breathe and to stay alive. And it had no energy left to fight the virus that was attacking my body. And what those professionals did, based on the gift of science and medicine, was to do some of those basic functions of breathing and metabolizing for me so that my body could take every ounce of energy I had and fight the virus. And by the grace of God and the help of science and medicine, here I am, because I was able to do just that. I lost nearly 30 pounds in 12 days. My medical team, my post-critical care medical team tells me that during the time that I was intubated on a ventilator in ICU, I was burning nearly 7,000 calories a day. Quite a workout, but not the one I would recommend. I think if I could share something that really struck me and I think is most important, is to just emphasize to everyone in our region that this is real. It's not a hoax. It's not a rumor. It's not fake news. We have not turned a corner. We have not defeated the pandemic. We are heading into some difficult times, I think. But I believe, based on my own experience in our amazing county and community, based on my own engagement in public life, that we're a resilient people and that we will figure out a way, but we will do it together. And we should do it based on science and medicine. And in the coming months, it's going to be challenging, I think. But we must listen to the medical professionals. We must heed their warnings, and we must have a care for each other. When we take the adequate precautions, we're not just caring for ourselves, we're caring for each other. And frankly, in my experience, the added horror that I have had to witness in addition to my own trials has been the utter lack of failure of federal and national leadership on this issue and during this pandemic. The utter failure to lead and coordinate a national response, to set minimum standards, to activate America's great industrial strength. All of those things cost lives, and they will continue to cost lives. So we're left on our own. We're left here in this region, in this state, to do it for ourselves. And so we can do it for ourselves. And so I would just encourage everyone to remember this is real. It's not over. We're going to have some challenging times, but if we care for one another, and if we listen to science, and if we just take small steps to have a regard for one another and for ourselves, we will save lives. So please remember that. I'm grateful for the county's leadership on this. I know we have much more to do, and I'm happy to share my story with all of you. Please care for one another and be safe. And with that, it's my pleasure to introduce and to welcome back Dr. Wooten.
Welcome everyone to today's briefing, and thank you, Council Member Padilla. Your comments give a voice to those infected with COVID-19 and bear witness to the fact that this disease is real, serious, and is not going away. Local COVID-19 cases continue to increase, as today's case count is 55,540 cases, which is 330 more cases than reported yesterday. The age range of cases is from 0 to 102 years of age. 62% of the cases were in the Latinx population. The 20 to 49-year-old age group remains at 58% or 31,994 cases. 28,484 cases, or 51%, are female, and 26,912, or 49%, are male, with no gender identification for 144 individuals. 3,883 cases, or 7% of all cases, have been hospitalized, and of that number, 905 have been admitted to the ICU, and this represents approximately 2% of all cases and 23% of those that have been hospitalized. The total number of cases includes 881 deaths, or 1.6% of the total number of cases, with 4 new deaths reported since yesterday. Now, of the 881 deaths, 840, or 95%, have had underlying medical conditions, and the remaining 41, or 5%, did not. The top 3 categories for the underlying medical conditions of those who have died remain the same, which includes hypertension, diabetes, and heart disease. Now, our triggers dashboard is shown here. Community outbreaks include this is the only metric that has exceeded the threshold that we have identified, And today we are reporting 31 total community outbreaks for the past 7 days, from October 21st through October 27th, representing a total of 133 cases. In the next slide. Thank you. There are 13 additional outbreaks reported, but we are late getting back the additional details for these 13 cases, so that information will be included in the slides that are pushed out at the end of the day. Moving to the blueprint for a safer economy, which is the tier framework with metrics and thresholds for each county to open more sectors. You'll see here, widespread is the purple, substantial is red, moderate is orange, and minimal is yellow. San Diego is and remains in tier 2 or the red tier. Now the county's COVID-19 in the next slide, adjusted case rate for the week of October 11th through October 17th dropped from 7.8 to 7.4 per every 100,000 residents. The adjusted case rate dropped from 7 to 6.5, which has us in the red tier, and the positivity rate increased from 3.3% to 3.5%, but we're still in the orange tier for this metric. And the health equity positivity rate dropped from 5.5% to 5.1%, also in the red tier. The San Diego County Health Equity Investment Plan has been approved by the state, and it is now posted on their website. I just want to be clear before going to our next topic. It is not a state assessment that places a county in one tier or another. It is the results of our individual and collective actions that align us to the tiers that we are assigned. With your help, we can make every effort to follow the recommended prevention strategies that I will review again in just a moment, to reduce the county case rate and lower testing positivity rates for the county overall and for the specific health equity areas that have been identified by the state. Thank you. So moving on to the next slide, an important reminder is that we are in the flu season. If you are not able to get a flu shot at your healthcare provider or do not have a healthcare provider, the county is offering 6 vaccination sites until November 3rd. 3 of them have already occurred, and the remaining 3 are listed here. I am happy also to report that seasonal flu vaccinations are being recorded in our San Diego County immunization registry at a higher rate than at the same time in any previous flu season. With almost 740,000 San Diegans immunized through the CDC Disease Week number 43, which is from Sunday, October 18th, and ending Saturday, October 24th. Now, as I remind the public every week, the following simple preventive strategies are evidence-based and have been proven to be successful to show us how we can slow the spread of COVID-19 until a vaccine is available. These strategies include washing your hands and promoting sanitation practices, staying 6 feet apart from others, wearing a facial covering, avoiding crowds, large gatherings, and groups, and staying home if you are sick. That is a particularly important strategy. If you are sick, do not go to work, do not go to school. These strategies matter because they decrease testing positivity and case rates to prevent the spread of COVID-19, and the same strategies also help to decrease the spread of influenza. Before closing, I want to touch on what I know is an exciting time for the youth and for the old alike. It's Halloween this weekend. Both the state and the county have developed guidance for Halloween celebrations. Please note that many traditional Halloween celebrations, such as parties and in-person door-to-door trick-or-treating, pose a significantly high risk of spreading COVID-19 and are strongly discouraged. These activities involve face-to-face interactions with people from different households, and if an infection is detected among participants, it will be very difficult to find and notify those individuals that have been exposed. Some recommended safe alternatives, as shown on the flyer that has been developed and is found on the county's COVID-19 website, include drive-through events and car parades, and dressing up homes and yards with Halloween-themed decorations. Please be safe and stay healthy this holiday weekend. A boo and a cackle can be great fun, but COVID-19 is definitely not. Now I would like to welcome back to the podium Chairman Cox. Thank you.
Thank you, Dr. Wooden. We'll get right into the questions.
The first question will be from Artie Ojeda with NBC7.
Good afternoon, everybody. I know you can't prevent families from traveling out of state to play in sports tournaments, but I'd like you to reaffirm your position on traveling youth sports teams. And I bring this up because one of the positive students in Vista is said to have contracted the virus from a traveling team. We know that teams from San Diego are going to Arizona and Nevada to play. And we also, in a new twist, have video of local volleyball clubs playing in tournaments, I think, against the rules in Riverside and San Bernardino County. So, what do you tell families struggling with this? And again, just can you reaffirm your position on traveling youth sports teams?
Okay, Dr. Wooten's going to respond.
Thank you for that question and the opportunity to just reinforce what the recommendations are. We are very concerned about sports teams traveling outside of the state and even participating in sports events. Currently, the state does not recommend competitive sports activities. There are guidance about practicing, and that allows for the children and adults to social distance, wear facial coverings where appropriate. But we do not recommend this because it presents the opportunity for increasing the spread of COVID-19. So we've said this since the beginning. This is not a recommendation.
Right, and I appreciate that. However, it's clear that more and more families are, breaking, and they're taking part, and, frustrated families are doing this, and the consensus seems to be that it's going to be happening more often, so that's got to be a concern.
As I stated, Artie, yes, we are very concerned. We can tell people what the recommendations are, but people have to take the responsibility and the collective action to adhere to these recommendations. So we are concerned, and when we find out about the issues, we address them, but this is not a recommendation by the County of San Diego and not by the State of California. Thank you.
Thank you.
Okay, we'll move on to the next question.
This next question is from Anthony Pura with 10 News.
Good afternoon, everyone. I guess I would just ask that it would seem as if San Diegans have been overwhelmingly behaving over the past few weeks. Businesses have, followed the rules. People have been wearing masks. They've been social distancing. But it seems like the best we can do is stay in the red tier. Is there anything else that you're seeing, any other areas that the public can improve in to really move us into that orange tier? Because it seems like those case rates, even though they've declined slightly, there's still a lot of work to do. So what other areas can people improve in, can the county as a whole improve in to get us into the orange tier?
Okay, Dr. Wooten's going to respond.
Well, I know we sound like a broken record, but the strategies, really, those are they're simple, but they are tried and true, and we are seeing the evidence and the impact that these best practices have, even as we enter the flu season, with the number of influenza-like illnesses showing up in the emergency room. While a large number of the community is definitely adhering, there are some individuals and some groups, some businesses that are not. So we ask that all businesses hold their clients and their patrons accountable. We ask that individuals adhere to these guidances. We ask that people not have large parties. That's one factor that has been pervasive throughout this pandemic. Having parties, particularly renting Airbnbs or in your backyard, all of those matters, those factors, those actions, those behaviors, all of them matter. And if people will just, and I know there's fatigue, I certainly understand that, but as we've also stated, this is a marathon, it is not a sprint. And by practicing these behaviors for a few weeks and then stopping it, it sends us into the yo-yo situation as well. So this is will have to become a way of life until vaccines are available. So thank you.
Just to follow up on that, is there a particular area, you mentioned the house parties, is that seem to be kind of the larger concern right now that we're seeing that's contributing to our case rates from decreasing down to orange? Is there any particular area?
There is no particular area. It is one of many concerns. I think I didn't just say house parties, but when there are certain businesses that might not be enforcing the social distancing and face covering guidance. So it is across the board, and we're just asking everyone to do their part to ensure that these practices are adhered to in their businesses and in their personal lives. Thank you.
Thank you.
We'll proceed on to the next question.
Okay, this one is from Paul Sisson with the San Diego Union Tribune.
Thank you. I'm interested in the caseload that's going on out in our grade schools, K through 12. You know, these schools, some of them will have a dashboard where they'll post new cases, others won't. It might be a little different for public schools versus private versus charter. What is the county going to do, and when is the county going to start giving us some sort of regular update on new cases in K-12 schools? Some kind of aggregated total would be nice, maybe in the daily reports or weekly reports, to get a sense of what's new out there in the schools.
Okay, Dr. Wooten's going to respond.
Thank you for the opportunity, Paul, to remind people that we do that weekly now with the COVID Watch. In the latter part of the publication, we have a list of the exposures of cases that have been exposed potentially in schools. So that information is already being reported. We talked about it last week. This is the second week, and you can find it in the publication that was issued yesterday. So that is the COVID-19 watch.
Okay, thank you. So you don't plan to do a daily update like you do with all the other numbers?
Well, actually, in many outbreaks and situations previously, we've done weekly reports. There is no one practice there, so our commitment is to update these numbers. And as you can see, the numbers are a very small subset of the total numbers. We look at the last 2-week period, and then from the middle of June, I believe. So we are committed to, because we issued this publication, so we included in that publication on a weekly basis.
And then I wonder, in terms of the students and teachers and others who have been put into quarantines as a result of an exposure to somebody in a school who tested positive, have you seen any of those folks who have been quarantined so far actually test positive themselves? I guess they might call that something like secondary transmission.
So those will be close contacts of the case. Right now, we are aware of a few cases, particularly with, and it's been in the news, so it's no surprise, Vista Mission. High School. We've had a site visit there, and so we are working closely with the school district as well as the San Diego County Office of Ed. Dr. McDonald can share additional information.
Yes, thanks for that question. We are not aware of a secondary transmission in a K through 12 environment to date. We're obviously watching for that very carefully. Individuals need to be quarantined for up to 14 days because the incubation period can be that long. But we really are seeing most of the transmission occurring in the community and in households. And so these cases of children who are being detected in the K through 12 environment, they themselves to date appear to be exposed in those environments and not in the classroom environment. But we'll have to see as these individuals finish their quarantine whether we have any evidence of any secondary transmission. Did that answer the question?
Some of these schools have been open since August, and so there must have been a certain group that have been quarantined for other exposures that maybe haven't kind of risen to the level of news. And so I wonder in that group, so you haven't seen any secondary transmission there either?
Not that we've seen evidence of in terms of school kids. There have been some cases in which some staff have exposed other staff, but not among the children who are attending these schools.
Thank you.
We have one final call-in question. Let's go ahead and hear it.
This one will be from Will Huntsberry with the Voice of San Diego.
Hi there, everyone. I was just calling to ask about the community outbreaks trigger again. We've talked about it a little bit before. And I think last time I asked, Dr. Wooten said it was being reevaluated. You know, I think the trigger flips now when it's 7 outbreaks over a 7-day period. But, you know, we didn't know as much when we created that threshold months ago. We didn't have as many contact tracers. So I'm wondering if you have any update on what, you know, the state and researchers have come back to you and said in terms of, you know, should you set that threshold somewhere else?
Okay, Dr. Wooten's going to respond.
Well, thank you for that question. We are not changing the outbreak. We have not gotten any information from the state or others that we've reached out to. But again, the outbreaks are an indication. It's a downstream. It's even more downstream than deaths. It is an indication of how widespread the infection is within the community. So with these elevated number of outbreaks, that tells us that COVID-19 is still widespread in the community, even though, you know, we report to you every week and we are maintaining a red status. Our unadjusted rate actually is in the purple. And only due to the gift of testing the appropriate individuals are we adjusted to the red tier. So this virus is still widespread throughout the community, and the outbreaks are just an indication of how pervasive that is. So at this time, we are not changing. If we do decide to change, we will certainly let everyone know, but right now the threshold will remain where it is. Thank you.
And so you said you haven't heard anything back. So you guys asked the state and some researchers to weigh in, and no one had really anything to say about it. Is that right?
I have not got any additional information, but again, as the health officer, based on the rationale that I just gave you, we are maintaining it at 7 in the past 7 days.
Isn't it correct that we had a lot less contact tracers at that time, so we wouldn't have really had as good an idea as we do now about what constitutes a small number of outbreaks and what constitutes a big number?
It's not about how big or small the outbreak is, the number is. It's about, we know that this virus is pervasive throughout the community. That's the real issue, and it's not about contact tracing, it's about testing. The more we can get out into the community, test those that are vulnerable, test the populations that are at greatest risk, and isolate them from the general public, do contact tracing with that population, that's the way we get our arms around this disease and decrease the overall spread. Those are the actions needed to do that. And our staff and our county has done a great job in doing that, but there's always more that can be done on that side, but it really starts with the behavior of individuals in helping to decrease the spread of the virus. And that includes the preventive strategies that I talk about every Wednesday and that goes out in every news briefing or news release.
One last question about, you mentioned that it's downstream, it's a downstream metric, even more downstream than the death numbers. Can you just talk about what that means?
It's delayed. That's what it means. So cases are upstream. First of all, you test, then you determine who's positive or not. Those factors are upstream. That's why those metrics are utilized by the state in their framework. Downstream metrics, after you're infected, it could take a week or more to determine if you need to be hospitalized. And even more downstream are deaths. And even more downstream than deaths are outbreaks, because the definition for the outbreaks, you can have one case that may have occurred, say, in August, but within the next 14 days, you have additional cases for community setting outbreaks, and that constitutes if you have 3 or more from different households, not people that are roommates or household partners. It has to be 3 different households that are epidemiologically linked. That is a very downstream process. Thank you.
And Dr. Wooten, this first text message question is going back to a question about schools, and it's from Mario Sevilla with ABC 10 News. What is the county's guidance on a physical return to campus after a vaccine is approved and dispersed community-wide? And will the county continue to recommend distance learning after a vaccine is available?
Well, that is a what-if crystal ball. We don't have a vaccine yet. We are in the process of developing our vaccination plan, and I'm certain that the state will provide additional guidance regarding that type of issue later on. But right now, there is no such guidance for that. It's certainly, I'm sure, being thought about, but we do not have any specific guidance to that nature at this time. Thank you.
And this last text question is from Mike McKinnon with KUSI News. Will San Diego County issue more restrictive mandatory guidelines for private gatherings than the guidelines released by California's Department of Public Health? If not, do you think the state guidelines are appropriate for our county?
If you're talking about the gathering guidelines, we are following the guidelines as issued by the state when it comes to gatherings. I know there's been a lot of questions about holiday gatherings related to holidays. Certainly, most people are extrapolating the gatherings to the holidays, but the state has not come out with its holiday guidance yet. We are working on ours, waiting for the state so that we can be in alignment. But that information is forthcoming most likely in the next couple of weeks.
Thank you, Dr. Wooten.
That completes our questions for today. We want to thank you for your participation. This weekend is Halloween, and obviously normally it's a time of the year to dress up in costume, visit friends, and have parties and have some fun with your children. But I urge everyone to enjoy Halloween responsibly this year. Avoid large gatherings and large group parties. Mask up, but don't let your guard down. We want to thank Councilman Steve Padilla for being with us today to give us his firsthand experience in dealing with COVID-19. I would remind everybody that next Tuesday is an election, so make sure that you do vote. And with that, we will tell you that we will return next Wednesday at 2:30 in the afternoon for our next briefing. Thank you and have a very enjoyable Halloween. Thanks.